Krimsky Test. Prism reflex test, first described by Krimsky, is widely accepted as a practical method for estimating the angle of squint in patients with a blind or deeply amblyopic eye, regardless of whether they have eccentric fixation. The Krimsky test is a clinical technique or practical method for estimating angle of ocular misalignment in a patient. Optics. The principle behind the Krimsky test is to use a prism to shift the corneal light reflex in the deviating eye until it is centered on the pupil. The amount of prism required to achieve this alignment corresponds to the angle of strabismus. The PBRT differs from the prism cover test as it involves placing the prism before the fixing eye, and the fixing eye moves to overcome the prism while maintaining fixation in the primary position. According to Fick's law, each eye will make a conjugate movement of the same amount. Increasing the prism strength before the fixing eye will centralize the corneal reflection of the deviating eye. Requirements. Following are required: prism bar or loose prisms, pen torch, patient, examiner. Procedure. The patient is asked to fixate on a point light. Prisms of increasing strength, with the apex towards the direction of manifest squint, are placed in front of the normal fixating eye. Prisms are added until the corneal reflex in the squinting eye is centered. The power of the prism required to center the corneal reflex in the squinting eye indicates the amount of squint in prism diopters. Parallax error prevention. To avoid errors from parallax, the examiner observes the corneal reflex using only one eye and sits directly in front of the deviating eye while keeping the other eye closed. Modified Krimsky test. An alternative method involves placing prisms of increasing power in front of the deviating eye until the corneal reflection is centered. However, this approach is less preferred due to the difficulty in observing the corneal reflection through prisms. Advantages of PBRT. Objective test. The PBRT only requires the patient to fixate on the light, making it an entirely objective method, particularly useful for testing small children. Quick procedure. Compared to the prism cover test, the PBRT is quicker to perform, saving valuable time during examinations. Applicability. The PBRT can be used in patients with low visual acuity or those who have lost central fixation in the deviating eye. Limitations. Angle kappa influence. The PBRT's accuracy may be compromised by the inclusion of the angle kappa in the measurement, potentially affecting the results. Distance fixation. The PBRT is unsuitable for assessing distance fixation due to the examiner's head position, which hinders accurate observations. Fixation light interference. Ensuring that the patient does not see the fixation light during the test can be challenging, introducing possible inaccuracies. Conclusion. The Krimsky test provides a practical way to measure strabismus by using a prism to correct the corneal light reflex deviation. While it offers advantages in simplicity and objectivity, it is essential for clinicians to be aware of its limitations when interpreting the results. For more precise measurements and comprehensive evaluation, additional clinical tests and assessments may be necessary.